Hello, welcome to Raaonline. I am Dr. Vijay Raghavan. Now we are going to talk about inflammatory thyroid diseases. As the name implies, it's an inflammation of the thyroid disease. As in any other inflammatory disease, we classify them into acute, subacute, chronic. Acute thyroiditis is very rare. Subacute thyroiditis is otherwise called recurrence thyroiditis or granulomatous thyroiditis. Now chronic is more common than subacute variety. In coming to etiology, obviously the acute thyroiditis is a bacterial inflammation mostly caused by Staphylococcus species. Subacute type is secondary to viral infection like mumps, measles, influenza, infectious mononucleosis, adeno or Coxsackie virus. Chronic thyroiditis is predominantly an autoimmune disease. Regarding the pathology, obviously the acute thyroiditis is caused by infiltration of neutrophils. Subacute shows infiltration of lymphocytic infiltration, classically viral disease. In chronic thyroiditis, lymphocytic infiltration, variable levels of fibrosis, hypo or hyperplastic follicular cells, otherwise called thyroid troughs. Now coming to clinical picture, an acute thyroiditis as expected will produce pain, fever, dysphagia, hoarseness of voice, tender, enlarged thyroid gland. When it comes to subacute, it is neck pain, mild tenderness, malaise, fatigue, mild hypothyroidic syndromes. When it comes to chronic, obviously there is no signs of inflammation. It is diffuse smooth enlargement, transient hyperthyroidism, followed by euthyroid, followed by hypothyroid status in later stages. Coming to investigations for thyroid disease, acute thyroiditis, the thyroid functions are normal. Complete blood count shows classical acute infective parameters with increased neutrophils. Antithyroid antibodies are negative. In subacute thyroiditis, thyroid function test is again normal. Most of the pro-inflammatory markers are elevated like C-reactive protein or interferon alpha, whereas antithyroid antibodies remain negative. So, leaves only to the chronic thyroiditis where patient has a thyrotoxic state in the early, euthyroid in middle and hypothyroid in later stages. Antithyroid antibodies are classically positive. Now coming to investigation, radioactive study may be useful in chronic to identify differential uptake when there is a suspicious clinical nodule. Otherwise, in acute and subacute, radioactive study is completely not useful. When it comes to ultrasound also, it has a very minimal role. Maybe in acute thyroiditis, it can detect an abscess. In subacute thyroiditis, it may show hyperechogenicity. When it comes to fine needle aspiration cytology, is useful only when malignancy need to be ruled out.